Anatomy of the trachea. The trachea is a non-collapsible, wide tube forming the beginning of the lower respiratory passages. It is kept patent because of the presence of C-shaped cartilaginous rings in its walls. The cartilages are deficient posteriorly, this part of the wall being made up of a muscle that is trachealis and fibrous tissue. The soft posterior wall allows expansion of the esophagus during passage of food. Trachea in Latin also means rough air vessel. This is the diagram of trachea. Dimensions of trachea. The trachea is about 10 to 15 centimeter long. Its upper half lies in the neck and the lower half in the superior mediastinum. The external diameter measures 2 centimeter in the males and 1.5 centimeter in the females. The lumen is smaller in the living organisms than in the cadavers. It is 3 mm at 1 year of age and corresponds to the age in years during childhood with maximum of 12 mm at puberty. Cervical part of the trachea. The trachea begins at the lower border of the cricoid cartilage opposite the lower border of the C6 vertebra. It runs downwards and slightly backwards in front of the esophagus, follows the curvature of the spine, and enters the thorax in the median plane. In the neck, the trachea is comparatively superficial and has the following relations. Anteriorly, there is the sternohyoid and the sternothyroid muscle, then the pretracheal fascia, the thyroid isthmus, the investing fascia of the neck, the skin, and the superficial fascia. Sideways, there are lobes of the thyroid gland and the carotid artery. Posteriorly, we have the esophagus, the recurrent laryngeal nerve, and the longus colli. Blood vessels and nerves. The trachea is supplied by branches from the inferior thyroid arteries. Its veins drain into the left brachiocephalic vein. Lymphatics drain into the pretracheal and the paratracheal nodes. Parasympathetic nerves are sensory and secretomotor to the mucous membrane and motor to the trachealis muscle. And the sympathetic nerves are vasomotor. Clinical anatomy of the trachea. The trachea may be compressed by pathological enlargements of the thyroid, the thymus, the lymph nodes, and the aortic arch. This causes dyspnea, irritative cough, and often a husky voice. Tracheostomy is an emergency operation done in cases of laryngeal obstruction. It is commonly done in the retrothyroid region after retracting the isthmus of the thyroid gland.